Blood is said to be the lifeline of every living thing. It is an essential in the running of every successful healthcare facility. Because for accident victims, women delivering babies, or people with peculiar health conditions, blood is often required to restore their health. Many times when blood and other blood products are needed for patients, family members are the first port of call. Where that is lacking, the option of voluntary donor is explored along with blood banks. However, there have been issues with adequacy of particular blood types in blood banks of hospitals, and at the far end, for some, is the challenge of cost, and these may set families running helter-skelter in a bid to save their loved ones. On this episode of the program, we will be looking at access to safe blood in Nigeria, what you need to know and what you should be doing in case of emergency. I am Salwa Khalil Ibrahim, and this is Health Options. The program is Health Options on the NTA, and we are looking at access to safe blood in Nigeria. The provision of safe and adequate blood has been noted as fundamental to every country's national healthcare policy, and it is imperative for hospitals to ensure adequacy and for citizens to be armed with knowledge about how to save themselves or their loved ones in case of eventualities. To put this conversation into proper perspective, I will be joined shortly by Professor Sali Yuguda. He is the Chief Custodian of Nigeria's National Blood Bank and Director General of the National Blood Service Commission. It's time to begin the discourse, and I have with me the Director General of National Blood Service Commission, Professor Yuguda. Many thanks for joining us, Prof.
Good morning. It's a pleasure to be here.
Okay, to begin with now, how well are we doing in terms of blood banks operations in Nigeria hospitals? Are we sufficient to meet hospitals' demands?
Good morning, Nigerians. Once again, thank you very much for having me here. Well, what I can say here is that we are not yet there. We are not able to meet the demands of the society in terms of blood donation. But all we know is that most of our hospitals have blood banks there, and they operate blood services. But unfortunately, most of our services in Nigeria currently are fragmented, not well coordinated. And as you all know, the blood service is very delicate service for ensuring the treatment of several conditions, because blood cuts across most of the ailments, both communicable and non-communicable diseases. So we are not yet there, and most of our hospitals, as I said earlier, they have blood service, but it's highly fragmented now. So what we are doing as a commission now is to map out all the blood establishment in the country as the first step, so that we know where they are and what they are doing currently. And from there, we can now move ahead to regulate what they are doing there. So this is in line with the mandate given to us by the president of the country, President Bola Ahmed Tinubu, to ensure the availability of safe blood for everybody in the country.
Okay, you made mention of blood donation. Why do we depend solely on blood donations, or is that the only source of acquiring blood?
Yeah, unfortunately, blood can only be acquired through donation. Okay. As we are talking now, there is no technology to manufacture blood outside the human body. So we rely solely on blood donation. That's why we are calling on individuals to come out and be donating blood voluntarily. And these blood donations, we categorize them into three major groups. We have the voluntary ones, and then the family replacement, and some are commercial. So the voluntary donation, blood donors are the ones that we encourage people to do, because you are coming out to donate blood voluntarily without any thing attached to it. The second category of family replacement are those blood donors that donate blood to the hospital blood bank, usually when their relatives are sick and they are in need of blood transfusion. So these are the family replacement. We accept them generally, but we are trying to see that they are now converted to voluntary donors so that we encourage them to come back and donate voluntarily. Then the last category, which is the commercial donor, this is what we discourage, because according to the Nigerian law, it's prohibited to sell any part of your body at whatever cost. So we are trying to discourage that. It's criminal to sell your blood to anybody in the country as based on the Nigerian law.
Okay. Now, considering the delicate nature of blood and the need to ensure utmost safety of patients receiving them, I'm curious to know how blood types are sourced.
We have major blood groups, which we call ABO blood grouping system, where you will see that somebody will have either blood group A, blood group B, O, or AB. And these four blood groups are the major groups in blood transfusion. And then the fifth category is resource blood grouping, which we call, where you will see each of those four is either A plus or positive or negative. So these are the major blood group system we have. Unfortunately, we can't alter that genetic makeup of our individuals. So we usually type the people. Some people know their blood groups, some don't know. So when they come with the first thing we do is to type their blood grouping so that we know which category they belong to. And in areas of most blood banks are encouraged to have register of their blood donors, and they know the rare blood groups.
Okay. Now, you collect this blood most times from voluntary donors. Now, one would be wondering, how are these bloods managed? Do they have expiry date?
Yeah, all blood groups, once you donate blood and it's kept in the blood bank, it has expiry date.
Okay.
And this depends on the anticoagulant, or I can say the preservative use. Averagely, most of the anticoagulants used currently in the country have expiry date of 35 days if they are kept in the regulated temperature of between 2 to 8 degrees centigrade. So this is the expiry date. So all blood have expiry date as we are keeping them in the blood bank. But for those rare blood groups, more especially the AB negative or the negative ones, we usually discourage keeping them for a long period because they are rare, and to get the individual with such rare blood group in need of the blood is usually also very rare. So that's why in modern blood banking, you just type, keep and ask the donor to come whenever he's needed, more especially for the rare blood group. So that's how we source for them.
Okay. So now I'm coming to a question that concerns a lot of Nigerians. Now, we've been getting feedbacks on this. When accident happens or there are patients in the hospital who need blood transfusion, you see family members on social media, especially, calling for people to come and donate. And then many a times people will wonder what happened to the blood banks in the hospitals or the place of, the National Blood Center. Now, what can we do, in addressing some of these challenges? Because sometimes it's in a place of desperate need. People don't even wait, or you hear so many complaints. What are we doing to address those kind of issues?
Thank you very much for this question. Usually the blood bank operates just like a conventional bank, money bank, where it's not the money that you usually keep in the bank that you will get it when you need it. So what we do in blood bank is once you donate blood, we keep the blood in the blood bank so that when somebody is in need of it, we now take from the bank and give him. So in such situations where you have maybe massive casualty, either accident or natural disaster or whatever, that you need high number of blood units to cater for the individuals that are in need. So, and whenever you see people as rushing to get blood is due to the failure of our system. Ideally, we should have, like based on our own mandate, we are supposed to have a national strategic blood reserve where you have this strategic reserve in each of the geopolitical zones, and then including Abuja, Port Harcourt, Lagos, and Kano. So in this about 10 centers, we are supposed to have a national blood reserve, national strategic blood reserve, where whenever you have needs for massive blood transfusion for massive casualty, either natural or human man-made disasters, so you can just go into those banks and cater for the individuals that are in need. So we are currently working on that, and by His grace, we will be able to achieve that in the near future. Thank you.
Okay, Prof. Now, let's take a break here. When we return, we'll talk about the importance of blood donation. Stay with us. If you just tuned in, the program is Health Options, and we are talking about access to safe blood with the Director General Blood Service Commission, Professor Yuguda. Many thanks for being there, Prof.
Thank you very much.
Now, I know it's no longer news, but can you remind us about the importance of, donating blood voluntarily? And since we said we cannot sell this product according to law.
Thank you very much. The importance of blood donation cannot be overemphasized. There are so many importance that you will get from benefit that you will get from it. Like what I usually say, even if you didn't donate this blood, is naturally replaced after 120 days in your body. So each of your blood cells naturally die and is going to be replaced after every 120 days. So in essence, it's better for you to even donate it for the benefit of humanity. The other health benefits of blood transfusion donation are many. First and foremost is that it gives you an avenue for regular medical checkup. For example, whenever you come to donate blood, you will first be assessed, asked about your health lifestyle. They will measure your blood pressure, measure your weight, and in the process, they will give you health talk on how to maintain a healthy living. And also, when we collect your blood for donation, we screen it for HIV, for hepatitis B, hepatitis C, and syphilis. All this we do it for you.
And free?
Free, yes. So just imagine if you are going to walk into any hospital and request for this test. If you are going to pay, the money will be enormous. So this gives you an avenue where you will have regular medical checkups. And imagine if you will have this kind of checkup about 3 times in a year. So it is very important. And also, by donating blood voluntarily, you are helping the humanity. So it gives you that self-esteem that today I have donated and saved somebody's life. That enough is very important.
Now, there are many individuals and organizations who come together, to organize blood donation drive, which is for good now. Now, how are these managed, considering the complexity, of these actions in regard to safety of this blood? How do you manage those situations?
Yeah, we usually encourage, there are so many groups outside, so many clubs, so many NGOs, civil society organizations that are involved in voluntary blood donation drive. So this is very important because they come together and assist the government in sourcing for this rare commodity to save humanity. So what we do usually is to encourage them, and then most of them come to us for technical support, for which we usually give them some of our personnel to go out with them and give the health talk and the importance of the blood donation, voluntary blood donation for that matter, to the community. So we actually work together with them to make sure that they are doing the right thing. And when we collect those blood, we usually give it out to hospitals for use. So we are working together with them to see that the entire chain is safe even for the blood donor and as well as for the patients that are receiving this blood.
Okay. Now, a very interesting question now. There are people whose belief or faith do not allow them to donate or receive blood transfusion. What is your opinion about that?
Well, when you say about belief, usually we tend to be very skeptical about it. We know some beliefs, some that block them from donating blood or receiving blood. They feel that this is not right. All we can do is to encourage them to come out and allow such individuals to be saved, because even though the law mandated us to save anybody that is in need for blood when it comes to emergency service, so we don't wait for them to decide whether they want to collect blood or they don't want to collect blood, usually in the law of the country. And then there is also issue of the minors, the small children, where you see the parents or the guardians will not allow the hospitals to transfuse blood to their loved ones. So this is their belief, and we believe that with talk and encouragement, they may be able to accept it.
Okay. Now, we have heard of cases of infection, another mix-up in the process of blood transfusion, not necessarily coming from you, but how can hospitals especially ensure due diligence beyond what you do on your own part before blood transfusion?
That's why we want to make sure that all blood establishment abides by the rules and regulations concerning blood service generally. So what we do as a commission is to make sure that every blood establishment in the country is registered with us, so that we know what they are doing. We know that they are also abiding by the minimum standards set up by the WHO and the Federal Ministry of Health when it comes to blood transfusion. So we are trying to see that they are doing the right thing. And unfortunately, most of the complications that arise from blood transfusion worldwide is due to human error, either usually error of transcription. Maybe you want to write A, you now mistakenly write B. And then that blood, once it's given to the individual, will cause a problem for him. So that's why you have a lot of checks in issuing out blood. So when it reaches the hospital also has the mandate of making sure that they recheck that blood grouping at least, so that to be sure that the blood they are giving the patient is correspond to his own blood group. That's what we call grouping and cross-matching. So they now do the remaining process so that to checkmate this kind of errors. Like I said earlier, most of the complications that arise from blood transfusion are as a result of human error.
Which of course can be curtailed, I guess.
Yeah, anyway. This can be avoided.
Okay, many thanks for your insight, Prof. And I hope we not just as government, but individuals, we all contribute in keeping the blood banks red. It is time to learn from Mother Nature. What do we have for you? You will see in a bit.
The very, very powerful miracle plant. Whether you bite it, wash it very well. Can be used in different ways. Prevents malaria, issues of sickle cell. After washing it very well, you can do this. Chew it. You can also dry it. Yeah, only one. Nobody say go carry all the distance. And you can dry them and make tea out of them. The way miracle leaf germinates, that is the way to show you that it's really a powerful leaf and it's a blessed leaf from God. You can just put this in your room. The next thing you start seeing is germinating. In your own room, no fertilizer, no water, nothing. It starts germinating. And then our reference bitter leaf. Bitter leaf is fantastic. I presented my bitter leaf combinations as far back as 2003. Today, bitter leaf has become the most important capsules that people line up to buy in New York. And then the leaf of lemon. Fantastic. Dry it as usual. Make your tea. All preventing malaria. And then the Moringa oleifera, zogale. When you dry them under room temperature, the green nature, it can do so many things, including malaria. It has a lot of polyphenol. It has vitamin C, which I told you is an antibiotic. Malaria is a bacterial infection, can be dealt with with the antibiotics that is gotten from only zogale. If you uproot zogale here, you cut everything down to the root. Before you know, in 3-4 days, it never dies. The same thing with guava. Guava, we can't bring all the leaves here. Guava, mango, garlic, ginger, you boil together, it brings malaria down. So you can use one powder in pap, in tea, morning, evening. In fact, on a continuous basis, because as we age, our muscles will start depleting in power and all that. The protein that we get from zogale is it's a superfood, as a matter of fact. This is a scent leaf. Scent leaf. It looks like bitter leaf also. Scent leaf is a brother to bitter leaf. It can be used in similar ways, either by drying or using their fresh leaves, boiling them and drinking them. Very, very good as an anti-malaria. If you can stand the bitterness, and for some people, they like sweet things. Sweet things is what creates problems in our system. As we age, we must like bitter things. Those bitterness attack the bacteria, the malaria, and then it makes your system very uncomfortable for them. But when you take sweet things, and your body is full of sweet things, this bacteria multiply and all that. The Plasmodium causing malaria, it does not like the kind of bitterness that the bitter leaf has. So you can wash it. For me, even the bitter leaf water that women throw away, I add ice block and drink it. Don't take more than half a cup of that. You don't, because it's good, go and take 1 to 2 to 3, you'll be poisoning your system. Anything you do should be in moderation. Even in all this presentation we are doing, you should do them in moderation. When you boil the leaves of mango, you boil the leaves of lemon, you boil the leaves of, sometimes you may even put agbalumo leaf in them, and you filter it. It goes to kill the Plasmodium that is responsible for malaria, which we earlier said is the vivus and the F. falciparum. Malaria is not something you toy with. Try to prevent it and treat it. For further professional advice and counseling, you can reach me on 080 37 899 735. 080 37 899 735.
On this note, we conclude this week's episode of Health Options. Check us out at www.nta.gov.ng. We will also be looking forward to your questions, comments, and suggestions. Take care of yourself.